All right, future nurses, let's get into it. We're about to tackle a topic that is absolutely critical for your career, because what happens in the hours and days after a baby is born, well, that can be every bit as dangerous as labor itself. And your ability to see what's coming and to act fast, it's everything.
So let's start with a number that should really make you pause. According to the CDC, 3 out of every 5 pregnancy-related deaths here in the US are preventable. Just think about that. That isn't just a statistic on a page. It's a call to action. It means that with the right assessment and the right interventions, we can save lives.
And that's exactly where you come in. You're the one at the bedside. You're the eyes, the ears, and the hands of the entire healthcare team. You are literally the first line of defense. Your ability to quickly recognize that something is wrong, that is what makes the difference between a close call and a tragedy.
Okay, let's dive in. We're going to start with the #1 postpartum threat, which is also the leading cause of maternal death across the entire world. Postpartum hemorrhage, or PPH. This is the big one. This is the complication you have to be ready to handle at a moment's notice.
So what even is PPH, officially? Well, the ACOG definition is a cumulative blood loss of 1,000 milliliters or more, or, and this is key, any amount of blood loss that comes with signs of hypovolemia. We're talking a racing heart, dizziness, a drop in blood pressure, within 24 hours of birth. But here's the real takeaway. Any bleeding that makes your patient unstable is a crisis, period. It doesn't matter if you haven't hit that 1,000 milliliter mark yet.
Now, when a patient is bleeding, how do we figure out why? Well, we don't just stand there and guess. We use a really smart, systematic framework called the 4 T's. This little mnemonic is your guide. It's your roadmap for figuring this out fast.
The first T, and honestly the one you'll see most often, is tone. This just means uterine atony. The uterus isn't contracting down like it's supposed to after birth. This is the cause for about 70% of all postpartum hemorrhages. And the key sign you're looking for, when you feel for the fundus, it's not hard like a grapefruit. Instead, it feels soft, mushy, boggy.
And the second you feel that boggy uterus, you have to act. Your hands are your #1 tool. You're going to start massaging that fundus firmly to get it to contract, but you have to support the lower uterine segment while you do it to prevent inverting the uterus. At the same time, you're checking for a full bladder that can get in the way, and you're getting ready to give meds like Pitocin that help that uterus clamp down.
Okay, next T. What if you check the fundus and it's rock hard, right where it should be, but your patient is still bleeding? You see this steady stream of bright red blood. What does that tell you? Well, that's a classic sign of trauma. We're talking lacerations of the cervix or vagina, or maybe a hidden hematoma. The uterus is doing its job, but something else is torn.
So here, your role completely shifts. You can't fix a laceration with fundal massage, right? Your job is to get on the phone and notify the provider immediately for an exam and repair. And while you're waiting, you're doing supportive care, watching those vitals like a hawk, putting ice on a suspected hematoma, and getting the patient prepped for a potential procedure.
Our third T is tissue. This means a piece of the placenta got left behind. I want you to think of it like a doorstop. The uterus physically cannot clamp down all the way and close off those blood vessels if there's something stuck inside. And that's going to lead to bleeding that just won't quit, or a uterus that gets boggy again right after you stop massaging it. This is exactly why prevention is so important. One of the most critical nursing actions you'll perform is making sure you inspect that placenta for completeness as soon as it's delivered. Is it all there? If you think a piece is missing, you've got to let the provider know and get your patient ready for a possible manual removal or even a DNC to clear out the uterus.
And finally, our last T is thrombin. This is a problem with the blood itself. It just can't clot properly. You've checked the other 3 T's, the uterus is firm, you don't see any trauma, the placenta was intact, but she just keeps bleeding. You might see oozing from her IV site or little pinpoint bruises called petechia. This is a massive red flag for a coagulopathy.
When you suspect a thrombin issue, it is an all-hands-on-deck emergency. Your job is to escalate immediately. You'll be drawing coagulation labs, getting ready to hang blood products like plasma and platelets, and working with the whole team to figure out and treat the underlying cause, whether it's sepsis, preeclampsia, or something else.
So while hemorrhage is definitely the biggest and the fastest threat, it is not the only danger lurking in the postpartum period. So let's shift gears now and talk about a couple of other really common dangers: clots and infections.
Okay, this slide, you're going to want to take a picture of it. Seriously, screenshot this. It's your quick and dirty reference guide for the most common postpartum infections. Let's just run through the first one so you see how it works. Endometritis. What are you looking for? Fever, a tender uterus, and that classic foul-smelling lochia. And what are you going to do? You're going to administer IV antibiotics as ordered and keep a super close eye on those vitals. It's the same idea for wound infections, UTIs, and mastitis. This is your high-yield cheat sheet.
All right, let's turn up the heat a little bit. Let's talk about those events that are high acuity but low frequency. The ones you might not see often, but when you do, every single second counts. These are the catastrophic emergencies that need a perfect, coordinated team response.
Okay, I want you to think of DIC, disseminated intravascular coagulation, as a terrifying cascade of dominoes. First, some major event, like a placental abruption, triggers the entire clotting system to activate all at once all over the body. Second, this just burns through all the platelets and clotting factors you have. And third, with absolutely nothing left to form a clot, the body starts to hemorrhage, uncontrollably, from everywhere. It's a devastating chain reaction.
And then there's the one we all hope we never ever see, an amniotic fluid embolism, or AFE. It's incredibly rare, but it is catastrophic. This is when amniotic fluid somehow gets into the mother's bloodstream, triggering this massive inflammatory response that leads to sudden respiratory failure, cardiac collapse, and almost always DIC. The onset is immediate, and the impact is just devastating. So after hearing about all these really scary possibilities, you might be asking, okay, what is my role in a crisis? Well, it all boils down to one single thing: translating all this knowledge in your head into immediate, effective action at the bedside. It's all about your assessment skills and your ability to know what's normal versus what's a developing disaster. This right here, this is the core of your job, knowing the difference between what's expected recovery and what's a huge red flag. Just look at the temperature line. A slight fever, under 100.4, in the first 24 hours? Yeah, that can be normal. From dehydration, from the hard work of labor. But that same exact fever after 24 hours, that's a massive warning sign for infection. Or look at the uterus. It's supposed to get firmer and lower every day. If it's boggy, tender, or just not descending, that's subinvolution, and you have to act. Knowing these subtle differences is truly everything.
So this is what it all comes down to. The early warning signs for these huge complications, they're often really subtle. A slight change in her heart rate, a comment about just feeling off, a small but steady trickle of blood that doesn't stop. They are so easy to miss when you're busy. But seeing them, and more importantly, acting on them, that is the most important job you will ever have. So the real question isn't if these signs are going to show up, it's will you be the one who sees them.